Diljeet, and I am here to talk to you about certain eye conditions which are common, they are treatable, potentially visual threatening but often neglected by people. Glaucoma. In this, just like we have blood pressure, we have eye pressures. This eye pressure is necessary to keep the globe, the eyeball formed, as well as for blood circulation within the eye. But when the same eye pressure starts damaging the optic nerve fibers which connect our eyes with the brain, that's when the glaucoma occurs. There are certain risk factors for glaucoma, such as age more than 40 years, a positive family history, presence of diabetes mellitus, hypertension, history of eye trauma, or use of long-term steroids. What do we do in glaucoma? In glaucoma, in the clinic, in the OPD, we do certain procedures through which we look at the signs of eye damage. And according to the stage of glaucoma, we treat the glaucoma with either eye drops or non-invasive procedures like micropulse transscleral cyclophotocoagulation or invasive surgeries like trabeculectomies, which are more so used in advanced stages of glaucoma. Now, glaucoma, the trick is that most of the people who have glaucoma unfortunately don't realize they have it, because not all types of glaucomas can have symptoms. The second condition I am here to discuss is cataract. Cataract, in simple words, is the normal lens which is clear inside our eyes becomes cloudy. That's when light is prevented from traveling through the eye and stimulating the optic nerve fibers, and hence we see this. There are millions of people each year suffering from cataract as we age. But the only treatment for this is surgical. We need to remember and we need to know that cataract, there is no medicine available till now for treatment of cataract. It is not reversible as such. We at Prime Hospital use the most latest Centurion vision system to operate on cataracts. Under the incision site is less than 2 mm in size through the cornea of the eye, and the surgery is called phacoemulsification of the cataract. Now, we can use different types of intraocular lenses. The diseased lens is replaced by either monofocal intraocular lens, for which after the surgery we need reading glasses. The second type is multifocal intraocular lens, for which the dependency on glasses is really reduced after the surgery. And third is toric intraocular lenses, in which the astigmatism involved in the refractive error is also dealt with. It's simple, it's quick, it's no-stitch therapy. The third thing I'm here to discuss is diabetes and eye. Diabetes is basically a microvascular condition which involves the eyes, the kidneys, as well as the peripheral nerves. In the eyes, it causes diabetic retinopathy in the retina. The simplest way to save our eyes from sight-threatening conditions with glaucoma, with diabetes, is that regular retinal screening is done. It's simple, we put eye drops, dilate the pupils, and have a look inside the eye for any possible swelling, bleeds, as well as blocks inside the eye. If the patient has nothing, no active disease, the patient simply needs to come once in a year to us. But if it's an active advanced stage, then more frequent follow-ups are required. If the swelling is at the center of the retina, it is called diabetic maculopathy. It needs special attention because it affects the central vision of the eye, the main central 10 degrees, 20 degrees, 30 degrees, that's what gets affected. And this is when we use special injections which are anti-VEGF, that is anti-vascular endothelial growth factor medicines inside the eye. Now, you may say that anti-vascular endothelial growth factor is a cool thing, because in diabetes, in abnormal conditions, abnormal blood vessels come and they are leaky. These medicines actually directly act on that leak and stop the leakage, stop the swelling to progress. So diabetes as such can cause diabetic retinopathy, which can be of various stages. It can cause diabetic maculopathy, which needs to be treated on an urgent basis. We all need to understand that eye is considered as one of the most important senses. Eyesight is the most important sense. But we eventually neglect it. we should realize that eye care is much more beyond glasses. It's much more beyond glasses, and it's as simple as walking into a clinic and saying hello to the ophthalmologist. Thank you and bye.